This is Selma Schimmel in Chicago at the annual ASCO meeting for the group room, joined now by Dr. Patrick Hu, Department Chair, Department of Melanoma Medical Oncology, Division of Cancer Medicine, the University of Texas MD Anderson Cancer Center in Houston, Texas. Welcome back.
Thank you for having me.
What about this year? How important is this year's ASCO in regards to melanoma?
I think it continues to be important. We're excited because there are continued incremental improvements in treatments. For example, turning off the BRAF light switch is important, but we know that the problem is that the response only lasts an average of 6 to 7 months. But it looks like, and they're updating the data at this ASCO, is when you combine two light switches, if you turn off the BRAF and the following light switch, the MEK light switch, and you flip both of those off, then the responses last even longer. And so that's an exciting advance, I think. The other one is taking the brakes off the immune system. We all know about Yervoy, which is an antibody that was approved last year that takes the brakes off the immune system so the immune system can then attack the cancer. It's FDA approved now for melanoma. But there's another drug, another two drugs that are coming along that are similar but take off a different brake on the immune cell, called anti-PD-1 and anti-PD-L1.
When do we expect more clinical results from the research that's going on right now?
I think there's some very interesting and important trials of combining these agents that are in the planning phases or initiated. So I think in the next year or two there will be continued advances in melanoma therapy to the point that we're hoping in the next 5 to 10 years to really be able to have long-term survival in the majority of patients with melanoma. I really can see that, but importantly, I think we need to take these principles that we're learning in melanoma and start bringing those out to other cancers. For example, the anti-PD-1 antibody I talked about that can take the brakes off the immune system and allow treatment in melanoma patients. Successful treatment in some patients with melanoma is also working in lung cancer, they're finding. And so I think these principles are going to hold true for other kinds of cancers as well.
So is the real future for the treatment of melanoma going to be immunotherapy based? Is that where we have found our most likelihood of the strongest efficacy?
Well, the question is, what do patients want? And from my perspective, every patient that comes to see me in the clinic wants one thing. They don't want to have cancer 5 years from now, 10 years from now. They want to be alive in the long run. And one of the only ways to do that is through the use of immune therapies, because the immune system becomes stimulated and those cells can survive in the body for a long time and continue to survey, and when a cancer starts to come up, then the immune system will kill that cancer. So you get long-term disease-free regression with immune therapies, and that's why I think it's going to be an important basis of treatment for not only melanoma, but for many other cancers as well.
Refresh us on melanoma about the other modalities of treatment that you use. Is there still going to be a place for chemotherapy in melanoma?
It's a very interesting question. And I'm using in my practice much less chemotherapy than I used to. We still have some clinical trials with chemotherapy and we'll continue to use it, but our usage of standard chemotherapy is much diminished compared to the use of targeted agents and immune agents. So right now the targeted agents are inhibitors of BRAF for patients who have that kind of a mutation in their tumor, a BRAF mutation. That's the kind of light switch that flips on their tumor to proliferate. And with the BRAF inhibitor, it's very clear now that that helps enhance survival in melanoma patients, and those data were updated at this ASCO. So it's very clear now, compared to the standard chemotherapy dacarbazine, the BRAF inhibitor is much better, both in response rate, progression-free survival, and overall survival.
Is there any place for radiotherapy in the treatment of melanoma?
Recently there's been some anecdotal information that perhaps doing radiation may stimulate the body's immune response by killing the tumor, releasing antigens, and so radiation could almost be seen as a vaccine to stimulate the immune system. Radiation, of course, will not treat the main issue of melanoma, which is melanoma spread throughout the body. Right. So when you do radiation, you just do a local therapy. But if it stimulates the immune system can go throughout the body.
Dr. Patrick Hu, Department Chair, the Department of Melanoma Medical Oncology, Division of Cancer Medicine at the University of Texas, MD Anderson Cancer Center in Houston, Texas.